So stretching and mobility, let's get up and move it around a little bit. So a few different things here. Let's move this out of the way. Sorry about that. I'll adjust here a little bit. Okay, so one is the active leg swing, right? So it's just kind of, if you need a chair or wall for support, then feel free to utilize that. The key is with whatever leg that you're going to stand on. So I'm going to go ahead and kind of swing my right leg here, which means I'm standing on the left leg. So I'm going to turn and face you. Make sure that you're not kicking your hip out. So that hip hinging that I talked about a ways back, we do want this kind of hip hinging when you're, bending forward type of thing where you're, hinging from the hips, but we don't want a hip hinging this way where you're just pushing that out. And then the pelvis drops, kind of throws, excessive pressure onto this hip joint and all the spinal segments up above it, along with probably your knee. And so you want to be really solid on that stance leg as you swing forward and back. Again, if you're sitting a lot of the day, then you're in this position, so your hip flexors are tight. So one of the big goals with that leg swing is you're trying to get, not only just a big kick here, but also really get back into good hip extension without your back having to instantly go into extension. So as you go into hip extension, if you don't have proper hip extension and it forces you to have to arch your back, then you're not really getting the hip extension out of your hip. It's coming from your back. So that's kind of where a virtual assessment or one-on-one with a physical therapist can help you, really figure out what's going on so that you can get nice and good motion in through there. Same thing on the other side. So I can also show this to you, kind of moving forward where you're, creating just some nice open, some counter rotation you can certainly create from the upper body, things of that nature. So standing calf and hamstring stretch. So let's go with the calf stretch first. So you could be up against the wall. I'm going to skip the wall for purposes here, and then leaning forward. And the key is that there's two different stretches here. One where your back knee stays straight. And so that's a better way to be able to get your gastrocnemius muscle that also crosses the knee joint. So it's important to know that you've got a few calf muscles. The primary ones are the gastrocnemius and the soleus. Gastrocnemius crosses the knee joint. So if the knee is flexed, then it kind of takes the gastroc out, and now you're stretching more the soleus. So as soon as you bend your knee a little bit, you probably feel that more towards your Achilles or your lower leg, just above your ankle, as opposed to here where you're going to start to feel it kind of more in the muscle belly. And then the key here sometimes for people is they have to just kind of, get a little bit lower, really make sure you're keeping your heel flat, make sure that you're not arching your hips and things like that, because that can start to make some changes as well. The hamstring stretch, honestly, I prefer to do it in this way where I've got a chair that I'm able to put it on. Now, whatever you can do there, ideally it doesn't, for most people, especially us guys, it doesn't have to be much above the knee. So you don't have to get your leg way up there. Some people who are more flexible, certainly they have different situation. But again, we don't want you, hinging with the hips. We want you nice and solid on your leg. Don't lock your knee. If you need a support with something in your room, I'm currently doing this on a moving chair, which is probably not the best idea, but I feel comfortable enough to do so. So I'm not recommending that you do that on an unstable surface that moves and twists. But just for demonstration purposes, this was the easiest thing for us to be able to do today. So here, and then the key is just kind of pressing your chest forward, and then you feel that pulling through the hamstring pretty quickly in my case, because I've been sitting all day. So that's kind of the deal there. You can also certainly do it like the lady is in this picture. I find for most people, it's hard to get much of a stretch in that situation, but up on a curve or something like that can be good. So let's move into the adductor stretch, kind of inner thigh. And again, here, the key as you try to stretch out, my right adductors here, the inner muscle on the thigh, make sure you're not leaning into the opposite knee, putting pressure in there. You really kind of want to be, pretty much in that frontal plane where you're just kind of in that position. So sit down into your opposite hip that you're not stretching, in this case, my left hip, and then being able to feel that stretch here. One other way that oftentimes people will feel this stretch a little bit more is if they reach up, you can potentially add a little bit of a, sideways bend, just to make sure that you're not, bending inappropriately. You're really thinking about reaching up nice and high, taking some nice deep breaths, things of that nature. And then obviously switch to the opposite side. Same thing if you're going to stretch out, reach up and above, like so, for some added stretch. And then the hip adduct or hip flexor stretch. This is actually the one that I was doing when I was talking about it from the chair. So in this case, right, you can be in this position and bringing that hip behind you, just like he is. So here in this position, if you wanted to, you can even turn the chair sideways a little bit, might give you another option. And again, here you're just kind of keeping your abdominals engaged so that you can feel a pull through the front of the thigh, making sure that your back isn't arching. So you want to kind of keep the pelvis tucked under you and get the hip to go backwards without your back pulling. So oftentimes people will say, oh, I don't feel it at all. That must mean I'm not tight. And the reality is probably they're so tight that they don't even know how to get there, that their back just kicks in before they can even know. So that's a consideration to have. Otherwise, sometimes I find that it just takes a little bit more one-on-one instruction and guidance. Sometimes you have to be in person so that your physical therapist working with you can really feel what's going on and see it. Maybe give you some tactile cues with their hands to help make it happen. Put it together with actually physically stretching you themselves so they can actually feel the tissues and control that. So a lot of different options depending on what's going on there. The other one that I think is really simple way to do the hip flexor stretch is just in a standing position. So again, kind of tucking those hips underneath you and then trying to feel that pull through the front. So I find that to be super helpful. So those are the main ones that we're going through with the lower body today. Let's take a look at the upper body. So shoulder overhead reach. So you can kind of hold on to one side of the chair and reach up and above. Again, it's not just collapsing over, right, and reaching. Really think about elongating everything on the right side of your body, as is the case for me, and reaching up and coming to the side and feeling it here. So just kind of getting that, or coming this way. Think about being nice and tall. Take some nice, slow, deep breaths. For most stretches, all the ones I just went through with you for the low back, I recommend about 6 slow, deep breaths. That's about how long it takes for oxygen to get to the tissues, for your muscles, for the brain to receive the message that your muscles are trying to stretch, and for it to kind of shut down some of those things that are holding it back and to allow some blood flow to that area. The other thing would be, just kind of reaching, towards a wall type of thing, and then allowing yourself either, this stance and coming down. So maintaining your hands up there nice and tall, coming down so you can kind of feel a nice stretch through probably the lumbar spine, lumbodorsal fascia, things like that. For the wrists and hands, this is kind of one of the most common or easy ones to do here. So you should feel this stretch kind of through the front, through your wrist flexors. You can also then move into stretching out the wrist extensors in this way. Again, you want to be nice and solid there. Be sure that you're in good position with the shoulder, so it's not torqued too far forward. And then you can just feel, again, just a nice long arc through there for the wrist extensors. The other thing is a shoulder shrug or shoulder circles. So coming up and around and then down and back. One of the key things that I find is really important, that honestly I need to do a little bit more work on myself, is really bringing the shoulders down and back. So it's almost like thinking about taking those shoulder blades and squeezing them together. What I usually tell my patients and clients, it's like you're squeezing a $1 million bill between your shoulder blades, and you don't want anyone to take it. So you want to really get that back, which is going to help you get a little bit more stretch through the pectorals, through some of the anterior neck muscles, and really get control through the shoulder blades, which not only helps set up the neck for success, but also the shoulders. You can imagine if my shoulder blade and the thoracic spine is rounded, it's going to be hard for me to move my shoulder properly. So this is really important. It can, change breathing habits, things like that. One quick tip, I know we talked about other ways how, posture, and ergonomics and things will affect the lungs, but just real quick, since we're talking about it, go ahead and take a deep breath in, get into a really slouch position and try to take a deep breath in. Right? It's kind of like taking a breath through a straw. Then go ahead and put yourself up in this position, squeeze those shoulder blades back, and then take a nice slow deep breath. Right? And it's just a very different situation. So again, that's what's happening, right, with your lungs and your rib cage, thoracic spine, shoulder girdle, scapula, all of those different things is really important. So again, just kind of coming up and around and then squeezing down and back. And then the last one we have here is just a pectoral stretch through a doorway. And you can do this both hands or just one at a time. And if I'm honest, I think doing one at a time is better. So just kind of putting one hand up as if I was in a threshold or against a wall or something like that. And then I typically am taking my left foot. So if I've got my right hand, I got my left foot forward, and then I'm rotating away, trying to open that up. In some cases, I'm actually actively trying to contract or utilize my scapular muscles to pull that back as I rotate through, and then same thing on the other side. So left arm up, right leg forward, and then rotating away so that you've got that pull through there. Otherwise, you can certainly go into a doorway. Just don't lean into and put excessive stress, onto the shoulder joints and things of that nature. Really make sure that you're keeping a good upright posture. Try to ensure that you are breathing properly and things like that. So, and then just a postural stretch. We talked about that forward head position quite a bit today and how that makes tightness into here. So one of the biggest things that's probably most common, and if you've ever been to physical therapy for neck issues, probably this is the thing you get is this chin tuck where you're kind of making a double chin. So if you've been to therapy, you can go ahead and laugh at me, but this is one of the ones that we use all the time, and it's for a reason. But again, you can't be in a poor posture and then try to do this. You've got to really set everything up from the ground up. And that's something that, our therapists really, really teach here and work on, is to keep those shoulder blades back and then be able to pull that chin back. And it's just like kind of sliding it through, like a drawer. You're kind of almost even thinking about like you've got a wire, almost pulling you kind of up and back type of thing as you do it, right? So you're just kind of in here and then being able to take some deep breaths. I'm starting to get comfortable with that. So that's just something to do throughout the day. And then postural stretches, so different trunk rotations and things like that.